Good morning, everyone, and thank you so much for joining us for Spirit, the stimulating program initiative for retirees that inspires thought. I'm Judy Steinig, Director of Community Programs for the Orthodox Union, and it's my honor to coordinate and host this program. The OU started Spirit several years ago as an on-site program, and now we're happy to present it as an online program for baby boomers, empty nesters, retirees, not yet retirees, sandwich generation parents, and seniors. Everyone who is looking for educational, intellectual, and spiritual growth. Now, during the pandemic, while we all continue to shelter in, Spirit has become the perfect way for all of us to engage in a virtual setting. The Spirit program has become acquainted with the educational outreach efforts of Weill Cornell Medicine from New York Presbyterian Hospital of Queens. We've appreciated their assistance in connecting us with some of their experts, and we've enjoyed many of their programs so far. Today, we will be addressing managing neck and back pain, something that I think every one of us is all too familiar with. And we are honored to have a presentation by Dr. John Buza, who is an orthopedic spine surgeon at New York Presbyterian Medical Group of Queens. It is my privilege to welcome Dr. Buza to the Spirit Forum. Thank you, everyone, for joining us.
All right. Thank you so much, Judy. And it's really an honor to be part of this Spirit program and to be invited to talk today. That was a great introduction. So just a little bit more about my background, just so everyone is familiar here. I did most of my training in New York, and I did a orthopedic surgery residency at NYU. And then for fellowship, I did a spine surgery training. And now I'm a spine surgeon at New York Presbyterian Queens. But today I'm really not going to talk too much about spine surgery. I really want to focus on managing neck and low back pain. And I'm going to kind of group them together for the purpose of this talk. And there are really three challenges. Much like Judy said, this is something that we've all experienced in the past, so everyone's very familiar with it. And it's a challenging topic for three main reasons. So the first is that back pain is very common. Typically, when I have any audience like this and I ask people, how many of you have had back pain in the past, almost everybody raises their hand. And you can see these people are all raising even two hands. So it's very common. Sorry, one second. There we go. So about 85% of Americans experience back pain by the age of 50. They're the most frequent cause of activity limitations in working age adults. And low back pain is one of the most common reasons for seeking medical treatment. Approximately 15% of adults seek treatment for low back pain in any given year. And 2% of the US workforce is receiving compensation for low back pain disability, which is a pretty crazy number if you think about it. So I see a lot of these patients. In terms of office visits, low back pain and neck pain are the fifth most common reason for US office visits. And there's over 16 million office visits per year for this. And up to 5% of primary care physician visits are for low back pain. And it's of course the most common reason to see a neurosurgeon or an orthopedist. So the second part, in addition to the fact that it's very common, is that it can be really confusing. And I know a lot of you have experienced this before, seeing your doctor. So you see a lot of it in popular media. It's frequently on the covers of magazines. You see commercials for it. It's on TV shows. And there are all sorts of different treatments for low back pain that are promised. So this is from one particular Reader's Digest. They recommended an infrared belt, which costs over $2,000. They had a magic spinal wand. I'm not sure what that is. Stem cells, different types of bone growth, a new bed. So there are a lot of different cures that are recommended in popular media. But even if you ask experts, this is actually a study from the literature where they asked, professionals, essentially, spine surgeons, physical therapists. They asked them, what is the cause of low back pain? And there's really varied responses. We have some professionals or experts saying it's from the muscles, some from the ligaments, the facet joint, the discs. Some people have fascial problems. This bottom one says 50 to 70% of these symptoms are psychological in origin. So there's not a lot of consensus on what causes back pain. And even if you ask those same experts, what are the best treatments for back pain, you also get a lot of different answers. Some people say physical therapy, some injections, some exercise, electrical stimulation, surgery. So this can be very confusing for patients. And I found that a lot in my office. The third problem is that this is very costly, both to patients and to society as a whole. So because back pain is so confusing, we're seeing that physicians, practitioners are ordering more imaging studies. There's an increased incidence of surgery, increased use of injections, pain medications, but there's really been no decrease in disability from back pain. And this is pretty old now, but in 2013, nearly $90 billion were estimated to have been spent on neck and back pain, which is really quite staggering. And I'm sure that number is higher now. So this leads us all to kind of scratch our heads. We say, well, I've had these episodes of back pain in the past or neck pain. I'm not quite sure what caused it. I'm confused as to the best treatment. But fortunately, there is a light at the end of the tunnel for this. And the good news is that the natural history of back pain, kind of regardless of the cause, most causes, I should say, is very favorable, which is good. And I know a lot of you have experienced this in the past where you've had an episode of bad neck or back pain, and then it's resolved over time. Probably took more time than you wanted to, but it did get better. So it's estimated that approximately 90% of back and neck pain improves within 6 weeks. And it's really that 3% that doesn't improve within that 6 to 12 week period that can be difficult. But for the vast majority of patients, surgery, chiropractic care, all the other treatments are really considered no more effective than no treatment at all in reducing low back pain. So the key is prevention. And that's what I'm going to focus on today. So the purpose of this talk is really to understand the anatomy of the spine, the anatomy of the neck, of the low back, how to prevent back pain from happening, which I think is the most important, and then how to treat your back pain if it does happen. And then lastly, I really want to empower all of you to have the knowledge to know when you should see a physician. Sometimes having that knowledge is the most important, or any professional, I should say. So let's start out with a little anatomy. I think this is very helpful. So first, I'm going to direct your attention to the picture that you see on the right here. So this is a cartoon sketch essentially of the spine, looking at it from the side. So the bones at the very top of the spine are labeled the cervical vertebrae, and you see there are 7. And these are the bones that we classically say make up your neck. In the middle are your thoracic vertebrae, labeled 1 through 12. Those are the vertebrae that are attached to your ribs. And then below are your lumbar vertebrae, numbered 1 through 5. And that's classically what we refer to when we say your low back. The reason that most patients have either neck or low back pain is that the middle of your back, the thoracic vertebrae, are really protected and stabilized by the ribs. And that's why you're not moving as much through that area of your spine. And that's why neck and low back pain tend to be more common, because most of your motion is through your neck and through your low back. There are really 3 main purposes for your spine. One is it provides stability so that when you stand up, you don't fold in half. The second is it allows mobility. It allows you to bend, stoop, sit, lift. And the third is that it protects your spinal cord. And your spinal cord is not pictured in this image, but that runs through the middle of your spine, and it's surrounded by bone to protect it. So when I think of the spine, I think of it very simply, and this is how I think of it even when I'm talking to patients and looking at issues they may be having. And I think about these 5 areas as issues, or as areas or anatomical locations in the spine where patients most frequently have pain. So we're going to start with the first 3. So the easiest one, and the one you can see on the spine model prior, are the bones of the spine. Typically, when people refer to the bones, they're referring to the vertebral bodies. And again, in this cartoon, this is looking at the spine from the side. And you can see that this is where they say the body of the vertebrae. That's the main area of the spine in the front. You can see, so that's pictured here. I don't know if you can see my mouse or not. And then that space in between are the intervertebral discs. And the discs are kind of like the shock absorbers of the spine. So the discs they're almost like cushions or sponges, and they essentially absorb the impact from your spine during daily activities, and they also allow your spine to move. And I know a lot of people have heard about herniated discs or slip discs. And then lastly, on this image at least, are the facet joints. And you can see that on the far right, it's circled here. These are little joints in the front, or I'm sorry, in the back of your spine. So you can see these little joints can also be irritated as well, which I'll show you in just a bit. So I think about those three areas. Then I also think about muscles and ligaments. So this is a cartoon depicting the muscles and ligaments that run up and down the back of your spine, and you can see there are a lot of them. So these are really the muscles that help stabilize your spine in the back. And there's a lot of ligamentous support and muscles that run up and down the spine. This is a very common area to get injured. And then lastly are the nerves. And this is what we talked about before. So in this, you can see, if you look up at the patient's brain, the cartoon of the patient's brain up above, you can see that the spinal cord exits from the brain and runs down the middle of the spine. And it gives off a bunch of nerve roots as it travels down. So the nerves that come off your spine in the neck tend to run down your arm. That's why if you have a pinched nerve in your neck, you tend to get, pain traveling down the arm or to the shoulder. And then the nerves in your low back run down the leg. And that's when you've heard of people having sciatica or a slip disc, it tends to run down the leg. So I think about these 5 areas, and then I think about the different injuries that can happen to them. And I really classify it by these 5 areas. So you can have an injury to the bones. This is a fracture that you can see in the vertebral body in the front, which is common. You can have an injury to the discs. This is perhaps the most common. This image on the left, again, shows a normal intervertebral disc in the blue. And then you can see on the right, you can see where there's an area where that disc has herniated in the back, that's depicted in the red, and is pinching that nerve. And then if you look at the drawing here on the right, you can see again these healthy appearing intervertebral discs up above. These are, they're tall, they're providing cushion and support to the spine. And then down below, you can see where the discs have kind of degenerated. They've worn out a little bit. And this is typically through wear and tear or overuse over time. And part of it's genetic as well. And these are what we call degenerated discs. And when someone says that you have arthritis in your spine, this is typically what they're referring to. Those discs have worn out. Then you can have injury to the facets. These are the small joints that I was talking about. So when you move your spine or bend forward or backwards, you're not only moving through the discs in the front of the spine, you're also moving through these little joints in the back. And these joints, like any joint in your body, if they experience too much stress or too much overuse, they can become inflamed or irritated. And you can also develop arthritis in those joints. So some people have pain from their facets. You can have injuries to the muscles or ligaments. I think that personally for me, I think this is one of the most common reasons that people have acute back or neck pain. But you can see, this can happen from picking something heavy up. It can happen from stepping off a curb. You can have they're almost like micro tears, if you look at this depiction on the left, in the muscle or the ligaments that can cause a lot of pain and inflammation and spasm. And then the image on the right, you can see a ligament tear there as well. And then lastly, you can have injuries to the nerves. And this is what I was referring to before. Most people refer to this as sciatica. The medical term that we use is typically a radiculopathy, which is the same thing. It essentially means that you're having pain in the distribution of a nerve root. And you can either have this most commonly in your cervical spine, meaning you have cervical radiculopathy, so you have a pinched nerve in your neck that's running down the arm, or you can have lumbar radiculopathy, meaning a pinched nerve in your low back that's running down your leg. And that's the image that you see here. Most of the time, this pain is described as shooting pain or electrical pain, and you feel that pain typically shooting down the back of your leg, but it can be down the front of the leg as well. And this is most commonly from a herniated disc or a slipped disc. So these are kind of the common causes of back pain. And anytime a patient comes in for evaluation, I think through each of these causes. But sometimes, to be honest, the cause of back pain is not exactly clear. Even if we were to do all the imaging studies in the world, get an X-ray, MRI, everything, sometimes it's really tough to tell. And that's why it's very important to avoid it in the first place. So fortunately, again, and I'm going to hit on this again and again, most causes of back pain or neck pain do improve with time. So the question is, what can we do to avoid having that or experiencing that pain in the first place? And that's why I'm going to focus on prevention of pain today. So the key to prevention is to understand who's at risk. So certainly I have a list here, and this list is only partially complete. But certainly older individuals are at risk, or as I like to say, individuals that have had more birthdays. Those with congenital spine abnormalities, and that means a developmental spine abnormality from birth. So some people are born, for example, with a very narrow spinal canal. Those people are at higher risk. Smokers, any prior episode of back pain certainly puts you at risk for another episode of back pain. Those who are experiencing a lot of stress or depression in their life, which I'll talk about. Those who aren't really engaging in physical activity are certainly at a higher risk, which I'll talk about as well. And then occupation is always a big one. People traditionally have thought, and it is partly true, that people who are in jobs where they're using their back a lot, they're doing a lot of heavy lifting, are at increased risk of back or neck pain. And I think to some extent that's true. But certainly today, with more and more people at work on the computer, and especially during the pandemic, I've really found that people with more sedentary jobs who are sitting for longer hours, they actually seem to be at the highest risk of back pain for me. But we'll get through that. We'll get through to that as well. So how do we take care of our back? There's a lot of different reasons here, and this includes your back and your neck. And I know the Spirit program has touched on some great things, including nutrition and exercise and those things. So I'm really going to focus on kind of these first three, which is really proper body mechanics, lifting techniques, and then maintaining safe postures. So we're going to kind of go through each of these individually. And again, the thing I would like to reiterate is that a lot of people assume that back pain is work related. So you go to work, you're lifting all day, and you develop back pain. But I would say that a lot of this is caused by things that we do at home. And that's why it's important to look at the big picture. And you can really think about all the things we're doing on a day-to-day basis where we're using our back and neck. We're washing heavy dishes, pots and pans. We're carrying and loading groceries, picking up or carrying kids, walking the dog, yard work, shoveling snow, which I'll talk about. So we're really using our low back all the time, and our neck. All right, so we're going to go through a list here, and we're going to work on some proper body mechanics and posture here. So I know that many of you have seen people lift like this, and many of you have picked up heavy objects like this off the ground. And lifting is one of the most common reasons that I see patients in the office. They say, I picked something up the other day and I threw out my back, or I threw out my neck from lifting. And that's why this is kind of one of the most important things I wanted to touch on first. So how can we develop proper lifting techniques to avoid having any back pain? So, and there really is a proper way to lift things. So it's really not about how much you lift or move, but the way you do it. And this is a correct lifting technique here. And you can find, there are really great examples of this online. But a general rule is if you're picking something up off the ground, you want to center yourself over that object. You want to keep your feet approximately shoulder width apart, and you want to face over the object. And the main point of this is you really want to keep your back straight. And the way you do that is engage your core muscles or flex your stomach. You don't want to bend over through your low back. So you'll see in this example, this gentleman's doing a great job of keeping his back straight. He's bending at his knees and then holding the object close to his body, just above the waist. He's not holding the object well out in front of his body. Once you're carrying it, you want to turn with your feet and not twist with your lower back. Now, I know a lot of you, and even for me, are thinking, this is very difficult to do, especially if you have a hip issue or a knee issue. It's difficult to get this much mobility through your knees. And I do agree with that. So an even better recommendation is to avoid lifting heavy things off the ground altogether. So what I generally recommend for my patients is I say, don't place heavy objects on the floor. You really want to keep them on a table or another elevated surface. And I apologize, this cartoon here looks like it's from the 80s, but this is really the proper lifting zone here. And it's really kind of, between your chest and your waist, essentially, is where you want to keep most of your heavy lifting. That's kind of the safe lifting zone where you're less likely to throw out your back or your neck. And sometimes you have to raise or lower your shelves or make changes in your houses to be able to accommodate that. But we want to avoid lifting things off the floor. Second thing, snow shoveling. So I'm going to mention this briefly. I know for those of us who live in New York, not a lot of us are doing our own snow shoveling. But for those who are tuning in from elsewhere, so there are a couple keys with this. This is another common way that people tend to throw out their back. So first, you want to use a snow shovel. Don't just use any shovel. And then you can see in the cartoon on the right, he's kind of doing the same thing as our other gentleman. He's keeping his back straight when he leans down and really bending through the knees. And then when you lift up, you want to lift through your legs. And rather than twist your whole back, you want to turn to the side to release the snow. You want to shovel in shifts, so don't wait until there are 3 feet of snow on the ground. You want to stay hydrated, wear good clothes, and if you can, try to push the snow instead of lifting it, which is always better. All right, wearing backpacks. So this is a big one. I think a lot of people in this audience, including myself, are not wearing backpacks anymore, but this is a big one for your kids and your grandkids. So I know a lot of you have seen kids on the street. I see it all the time who are wearing their backpack like this girl on the far right. So the backpack should really be less than 15% or ideally 10% of the child's body weight. And what you want them to do is to wear both straps. The backpack should really rest evenly in the middle of the back. It shouldn't extend below the lower back like it is on the far right in this image. And you really want to place the heavier items, like the heavier textbooks, closest to the back. So in this depiction here, the girl's wearing a backpack properly in the middle. You can see she's maintaining her posture. And on the far right, this is what you want to avoid, where she's leaning forward with a heavy backpack. Next, all right. Other than lifting, this is probably the next most important one. So this is working from the home or the office. And I know a lot of you are probably straightening up in your chairs right now looking at this. I have seen a lot of patients during the pandemic that are having a lot of back issues because they're doing more work from home. So this is an important thing to hit on. So if you're working long hours at home, what I would advise is you want to use an upright chair that has a lot of good lumbar support. And the goal I tell people is they really want to hit right angles when they're sitting in their chair. So ideally, you want your back and your hip to be at a right angle, and then you want your knees to be at a right angle, all at 90 degrees. The worst thing is working from your bed, in my opinion, because your entire back is flexed at that point. So what I recommend is people sit upright, adjust the computer monitor so that the top of the monitor is at the level of your eyes so that your neck is in an appropriate position. And then you want to keep the mouse, you want to keep your arms supported and the mouse close to your body. And then perhaps most important is I usually recommend if you are doing a lot of work, set a timer for every 45 minutes, an hour. So you get up and walk around, take a 10-minute break. You don't want to sit there for 3 or 4 hours and really have your back stiffen up. This goes for driving as well. This is the same idea here. But for long drives, you really want to try to take a break, ideally every hour or so, and get out and walk around. And then also, if you can, you want to place a rolled up towel or some other lumbar support. They have a lot of them you can actually buy online that are fairly inexpensive to support your lumbar spine. And again, you want that 90 degrees between your hips and your low back to maintain good posture. Childcare, this is a big one. So being a parent can be very challenging on your low back. And we know this, kids are heavier sometimes than we appreciate. So what you want to avoid is carrying the child away from your body. Ideally, you can use a child carrier like this where you keep the weight close to the center of your body. If you are going to carry your child on one hip, you just want to make sure that you alternate your hips. So you're not always carrying the child to one side, because that can certainly strain your lower back and your neck. And then sleeping. Judy let me know, we did have a question about sleeping. This is probably other than working from home, this is probably the second biggest question I get. People ask me all the time what position they should be sleeping in. And I will tell you, if I had to rank the positions in order, I would say the best position, in my opinion, would be sleeping on your back. I think sleeping on your back makes it very easy for you to keep your spine in neutral alignment. But I found that a lot of patients with breathing difficulties at night or heavy snores, They try to sleep on their back, but they don't really like it, and they end up on their side. And the side is fine for me as well. That's my number two. A distant third is sleeping on your stomach. Sleeping on your stomach is definitely the worst position, and if you can avoid it, I would. Especially if you find yourself waking up in the morning on your stomach and you have a lot of low back or neck pain, it's really difficult to keep your back in neutral alignment. So I think most people tend to sleep on their side, and the goal is to really choose the correct mattress for you. I think for most people, that's going to be a medium firm mattress. You can see in the image up top, this mattress is too firm. So her hips are elevated and the shoulders are elevated and the spine is kind of out of alignment. The mattress in the middle is too soft, so the whole body is kind of sagging. And the mattress below, which, I think for most people is a medium firm mattress, really keeps the spine in alignment. It's very difficult to tell when you're sleeping if your spine's in alignment. One thing you can do is you can have somebody take a picture of your spine from behind and see if you're in proper alignment. That's an easy one. And you can certainly try different mattresses at store and see which one's most comfortable. But for those of you that are waking up with a lot of back pain or neck pain, I would certainly look at your sleeping habits a little bit and maybe think about adjusting them. So other than a mattress, the next big one is what pillow you should be using. And this is tough as well. So again, the key, the same as for your low back, the key is really neutral alignment. So I'm not even going to mention sleeping on your stomach here because I think that's impossible for your neck. But you can see the two demonstrations here. If you look on this top row, you can see this is a gentleman that's sleeping on his back. And so ideally what you want to find is the right pillow height to keep your back or your neck in neutral alignment, where really your shoulders line up with your ear. You can see on the far left, this is too big of a pillow, so his neck is really flexed. The middle image is either too small of a pillow or he has it right behind his neck, so his neck's very extended at night. And then you can see he has an appropriate sized pillow on the far right in his neck's neutral alignment. Generally, for those of you that sleep on your back, you're going to want a thinner pillow is generally the best. Sleeping on your side is a bit different. You can see, again, the goal here is to keep your head in neutral alignment. The image on the far left, that pillow is too high, so his neck is cranked off to the left side, and then the one in the middle, the pillow is too thin, so his neck is bent the other direction to the right. For most people that sleep on their side, they need a medium-sized pillow to accommodate for the space between your neck and your shoulder at night. And again, if you're waking up in the morning with a lot of neck pain, this is something that you'd want to look at, and I would advise trying a different pillow. All right. Most importantly, so we're going to switch gears a little bit now from some of those posture-related things to physical activity. I know there's been other talks on this, but this is really a key for preventing back pain is staying mobile and staying active. And there are too many benefits of physical activity to mention here, but really the goal is to find at least 20 to 30 minutes where you can do a small amount of physical activity each day to make sure that you can avoid back and neck pain. There's like I said, too many benefits to list of aerobic conditioning. And this doesn't mean that you need to go out on an intense run or anything like that. This means even 20 minutes of walking a day, 25 minutes, it can mean a lot if you're currently not doing that. So for patients that have had back issues or like to avoid back pain, my rules of thumb are generally to choose low impact activities. So if you really can't do anything else, again, just start with walking. I know the winter's upon us here, but usually if you bundle up and you can do a couple of laps around your neighborhood or block, I think that goes a long way. Spine surgeons tend to really like cycling, and that can be in place or outdoors, and the elliptical machine because those are non-impact activities. So again, you're not loading through those discs in your back. Patients tend to tolerate that much better. And then you can work up to more intensive things like jogging or dance cardio or things that are more fun if you'd like. And then the last part is strength and flexibility. Now, when I say strength and flexibility, a lot of patients say, well, I don't have a gym. I don't really like to lift weights, or I'm not very flexible, but this is not really what I'm referring to. I don't mean any heavy lifting or any intense flexibility like this. I think for avoiding back and neck pain, there's actually much more simple things we can do. What I tell patients, especially for low back pain, which is more common, is there's really two areas they need to focus on. The first is your core. So that would be your abdominals and your low back extensors. And then the second is your legs. For your core, it's very important to maintain strength. So this can mean, half sit-ups or planks, and I'll show you some of those in a bit. And for your legs, you really want to maintain flexibility. And hamstring tightness is a major cause of low back pain. And I'm always, measuring and recommending patients to work on stretching their hamstrings. People seem to, they always say, well, that's kind of silly. I have low back pain. I don't know why you're talking about my hamstrings. But really, all of these areas are connected. You can see that if your hamstrings are too tight here, it can rotate your pelvis in the wrong way and cause a lot of strain on your low back. And same thing, if your core is very weak, again, it can rotate your pelvis and cause a lot of low back strain. So what I have patients do generally is just find a simple routine. This is one that I like online, but you can really find a lot of these. There are a lot of images like this online, and there's also a ton of great material on YouTube. If you just type in, low back exercises or routine, where you can actually get an instructor on there to walk you through a simple thing. This is just 8 simple exercises. And again, they're focusing on hamstring stretching and core exercising here. And they're things we can all do. They can be formed on a yoga mat or towel, or things we can do at home. And I just say, find a routine that's 20 minutes. And if you like it, just stick with it. You don't have to do it, don't do the exercise you don't like if it's going to make you avoid the whole process. But certainly try it. And I think this goes a long way if you can find those 20 minutes to do it. And these can be done at the office as well. So if you're in the office for long hours or you're sitting at your desk, you can do a lot of these, and you can do the same. This is a cat-cow in a seated position. You can do stretching over to the side, where you grab one side of your chair and do some side-to-side flexibility. So even if you don't have the mobility to be able to get on the floor and do a lot of this stuff, you can still do it seated in a chair. All right, so stress management, switching gears a little bit here. This is a very big topic, and it's often difficult to bring up in the office with patients because patients come in with neck or low back pain, and you can tell they're very anxious or feel a lot of stress about it. It's tough to sometimes bring up and say that this may be contributing to the back pain. But I certainly think this can play a big role. Many self-motivated and successful people are prone to back or neck pain. Multiple studies have shown that anxiety and stress can cause muscle spasms. And I think a lot of us have experienced this. I know I certainly have. And people frequently think that back pain is inevitable, and it's not true. This is a book called Healing Back Pain that I actually purchased. That's great if you wanted to start somewhere. But it's really understanding the mind-body connection between these two things. And there are a lot of, again, simple techniques, meditation, breathing, stress reduction to reduce that stress and anxiety. And a lot of times that can help with back and neck pain. All right, so now we're finished with the prevention part. So some of you might be saying, thank you for the advice, John, but I'm okay. I've done well so far. I'm not going to get back pain. And then, you're walking and you step off a curb and all of a sudden you have back pain or neck pain. So now switching gears, what do we do when we actually have the pain, aside from preventing it? So I'm going to start with things you can do at home, and then I'm going to go into what happens when you come see a physician or a practitioner for it. So a lot of people, quote unquote, hurt their back or their neck, and they want to stay in bed. That tends to be the inclination, is you want to do bed rest because it hurts to move. But what you really want to do is you want to limit any sort of bed rest. That's the key. And there's been multiple studies that have shown this at this point. What you do want to do is gradually return to physical activity as early as you can. You can do ice heat, gentle massage, and then over-the-counter medications you can take. I'm going to go through each of these, but the most important thing, again, like we said early on, is really time. So I will admit, none of these things at home have great evidence behind them, just because they're very difficult things to study. However, kind of in my practice and a lot of patients' experience, these are great things to try at home. So this is perhaps the most important, which is really getting back to physical activity and movement. And this is kind of the cycle of back problems. You have an issue, a back problem or pain. It hurts to move. You kind of stop moving, and then you get stiffness there, and then you get weakness, and then it leads to more and more of a back problem. It's this recurring cycle. So I tell people, just get back to walking. You don't have to get back to the gym or exercising, but if you're having a lot of back or neck pain, just get back to walking. Avoid the BLTs, as we say, no bending, no heavy lifting, no twisting. Don't strain your back, but get back to moving as much as you can. A lot of people ask me, is ice versus heat better? There's no, definitive evidence that one's better than another, but this is kind of my general rule of thumb. For the first 48 hours, I really like ice. And I think this is the best for inflammation and pain. I recommend people just use a frozen vegetable pack. You can take ice cubes and wrap them in a towel. You just want to make sure you're not putting ice cubes directly on your skin, because obviously that can give you frostbite or a burn injury. After those first 48 hours, or if you've kind of had chronic low back pain, I really like heat. This is great for muscle spasm. It's great for your blood flow. Again, you can use just a moist hot towel, and they do sell different heat wraps in CVS or Duane Reade or any pharmacy that are pretty inexpensive as well. The next is massage. So for those of you with neck pain, I think a lot of manual massage you can do yourself. You can certainly get a family member to do it for you, or you can go to a massage therapist. And this really helps, again, with a lot of muscle spasm and pain. And nowadays there are a lot of somewhat inexpensive massage devices you can do. So I've had episodes of low back pain before. I actually purchased this bottom left device on Amazon. And you can find a lot of these. This actually emanates heat from it and massages your low back if you have a lot of spasm. This device in the middle, I think, is called the Back Buddy or Body Buddy, but it allows you to give kind of yourself a back massage if your loved one gets a little tired of that. And then this image on the far right is called the Chirp. This requires a little bit more mobility, but a lot of patients have had a lot of benefit from this as well. So a lot of the massage you can do on your own. And then again, time. This is the toughest thing to tell patients, but I do say if you have an acute episode of back or neck pain, 90% of the time it is going to get better on its own within 6 weeks. People tend not to like that answer because 6 weeks is a long time in our busy schedules, but for the most part, it does get better. All right, so a lot of people say, shouldn't I just see a doctor right away? The second you have back pain, shouldn't I go in and see him? My back really hurts or my neck really hurts. And the answer is usually no. Again, 85% of the time, we can't even find a definitive diagnosis for why you have, acute low back pain. And oftentimes, if you come in and we start to do a lot of imaging or get an MRI right away, a lot of times you can find something on an MRI that's not necessarily related to your back pain. And I see this all the time. This is kind of the one study I'm going to show during this talk. I have a lot of patients who come in and say, well, I have a bulging disc, or I was told many years ago I have, some disc degeneration. This is a study. This was actually a systematic literature review of imaging features. So these were all asymptomatic patients. So these are studies where they essentially went out into a primary care waiting room, and they asked, 100 patients who have no back pain or no neck pain at all to undergo an MRI of their back. And if you look at their ages up top, you can see even by the time you're 20 years old, up to 37% of patients had some evidence of disc degeneration. And by the time you're 50 or 60 years old, this goes up to 80 or 88%. And these are patients with no back pain or no neck pain. And then if you look at disc bulge, which is another common one I see, you can see by the time you're 20, 30% of patients have a disc bulge. And by the time you're 50, that number goes up to 60 or 69%. So disc bulges are disc hernia or disc degeneration. All these things are very, very common. It doesn't always mean that that's the source of your pain or the cause of your pain. Now, sometimes it is, and that's up to your doctor to find out. But that's why I generally recommend if you just have isolated back or neck pain and you've only had it for a week or two, I generally recommend treating it on your own at first before seeking, before needing to go to the doctor. But it is important to know when to seek professional help and who to see and what to expect. There are really a lot of different physicians and professionals that treat back pain, and you can really start with any of them. You can see your family physician or your internist. Great one to start with: physiatrists, chiropractors, neurologists, pain specialists, pain psychologists, and then spine surgeons. So these are my kind of general rules of thumb for when to see a physician. And this list is by no means all inclusive. So certainly if you have any questions about it, I would call your primary care doctor or doctor. But these are kind of the big ones, the most common ones. So back pain lasting longer than 6 weeks. I usually recommend if your back pain is the same or not getting any better by 6 weeks, I would see somebody for that, just because that's a long time, and I'm sure most of you would want to anyways. Certainly, if you still have a little back pain, but it's improving, I think you can hold off. But that's my general rule of thumb. Any associated weakness or numbness, in other words, you can't move your arm, your one arm is weaker than the other, your one leg is weaker, certainly a reason to see a doctor. If you have radiculopathy, that's that sciatica type pain we were talking about before. If you have pain from your neck shooting down the arms or pain from the back shooting down the legs, I usually recommend you see a professional sooner rather than later. Low back pain with difficulty walking. So this is a tough one. If a lot of times you can have low back pain and you can have had difficulty walking for a while because you have hip or knee arthritis or some other reason. But if you really feel like you have acute low back pain, it's become more difficult to walk, or neck pain, those are good reasons to see a physician or a practitioner sooner rather than later. And then any difficulty using your hands for fine motor functions, typing, writing, buttoning, those are good reasons to see a practitioner earlier. And then below, any associated fevers, chills, weight loss, history of cancer, all good reasons to see a practitioner sooner. And then any associated loss of bowel or bladder control. That just makes us a little bit more worried about the nerves going down your back. So I would recommend seeing a professional sooner rather than later. What your doctor will perform generally, a history, physical, plus or minus imaging. So the doctor will want to know certain questions. When did the pain begin? What caused it? Where does it go in your back? What makes it better or worse? Is there any weakness associated with it? And is there any loss of bowel or bladder control? Again, to check on the function of your nerves. They perform a physical exam. So, and I know a lot of you have had this before. This is me checking a patient's reflexes. And they might order imaging studies. These are the most common ones. We generally get x-rays initially if we need, or we get an MRI. The MRI is on the right, and you can see the MRI allows us really to see the discs and the nerves a little bit better. On the x-ray, we really are looking at the bones. And that when you see me, and any physician or any practitioner, we generally still progress through 3 stages. I start with physical therapy most of the time, formal physical therapy or medications. Next, I go to spinal injections if they're needed. And then last, and only in appropriately indicated patients would recommend a surgery. Physical therapy is terrific. I would say the vast majority of my patients with back or neck pain are treated and cured with physical therapy. There's a lot that physical therapists can do in their office that you just can't do at home. So I think it's terrific. The goal is finding a physical therapist that you like working with. The McKenzie method is one method of physical therapy. And again, if you're interested in this on your own, this is a great book on that if you want to get more knowledge about some of those treatments. And then the doctor may recommend medications. A lot of these medications are really just meant to decrease the inflammation, help with your pain as you get through that initial period of back or neck pain. Spinal injections are more and more common. If you get to the point where you're having really bad shooting leg pain or arm pain and nothing else is controlled, it will frequently try injections. Again, the point of these are really to decrease the inflammation and the pain there so that you can start to improve with physical therapy and those things. And then last but not least is surgery. So this is really only after conservative care has failed or in indicated patients. And the way I think of it is I really only recommend surgery to patients where they have a problem that can't be fixed otherwise. So for example, if your nerves, I know a lot of you have heard of spinal stenosis. So if your nerves or your spinal cord are being pinched so badly that, and there's no other way to relieve that, then I'd recommend a surgery. Or if the bones in your back are unstable, where one bone is sliding forward on another one, that's something that really can't be treated with an injection or therapy. And those are the times when patients do well from surgery. I will say there is a fear in the general public of spine surgery, and I don't blame anybody for that. Certainly everybody knows somebody who's had a bad experience or has been injured, or they didn't have a great recovery. But I will say that if you see a spine surgeon and they've determined that they think that spine surgery really help you, it really has improved significantly, I would say, over the past 10 to 20 years. We do more minimally invasive techniques now, meaning we're using much smaller incisions. We use neuromonitoring throughout the cases to make sure that there's no damage to the nerves throughout. I use computer navigation in my cases, so I make sure that any hardware I would need to put in is perfectly positioned. And then there's improved rehab and pain control protocols. So it really has gotten a lot safer. And I don't think it's something to be as scared of as I tend to hear. So in summary, back pain is very common. The diagnosis can be very confusing. 90% of the time it does resolve on its own, back or neck pain. And so the goal is really prevention. That's the key. Work on good posture, be safe when lifting, try to engage in some simple exercises, strengthening, stretching each day, reduce stress in your life if you can, and then know when to see a doctor. That's going to be it. Thank you for your time today. I really appreciate it.
Okay, thank you so much, Dr. Buza. We have a number of questions. Some I had given you before, and I think you've addressed them, but some are in the chat. So I'll just go through to see which ones are appropriate. Okay, what is the difference between sciatica and sacroiliac pain, and can they be treated with physiotherapy?
That's a great question, because they sound somewhat similar. They can both be treated with physical therapy. So sciatica is what we referred to before. The term we use for that is radiculopathy, and that essentially means that a nerve is being pinched, and that nerve pain travels typically down your arm or down your leg. That's sciatica, and it's most commonly caused by a herniated disc. Sacroiliac joint pain is pain from, like it sounds, from your sacroiliac joint. That's in your lower back on each side, and that's the joint that connects your spine to your pelvis. That's also a very common cause of pain. They can both be treated with therapy. The important thing is that your therapist knows which one you have, that you have the right diagnosis, so they can prescribe the appropriate therapies for you.
Okay. Can back pain sometimes be mistaken for hip pain?
Absolutely. That's a great question. That's very, very common. I see a lot of patients that come in and say, I have this back pain, but it's kind of over my, my right or my left buttock area. And that it's really hard to parcel out where it's coming from. Usually when I get low back x-rays, I have them include the top of the hips so that I can check for both of them. That's how common the overlap is. I would say for you at home, the key is when you're trying to elucidate between the two, is it worse when you're moving your hip? So you can move your hip at home, see if that causes, internally or externally rotate your hip, see if that causes pain. That's one simple test you can do to try to figure out which area it's coming from.
Okay, I'm going to lump the two of these together. One is how often should one purchase a new mattress and what's the firmness? And the other one is, should one sleep with a pillow under one's knees?
Yeah, so great questions. In terms of the mattress, it's really tough to tell. I always hear the common thing is you should get a new mattress every 5 to 10 years, depending on the quality of the mattress. One thing I think is, certainly look at your mattress, see if you're kind of creating a divot or a dent where you sleep every night. And if that is the case, you can also flip the mattress. But some mattresses, higher quality mattresses can last for a long time. So I think it really depends on the mattress. Just take a look at it and make sure that that the springs aren't wearing out over time. And then in terms of the pillows between the knees, I think that's a great idea. Certainly if you sleep on your back, I'd recommend putting a pillow underneath your knees. That can help a lot. And if you sleep on your side, you can put a pillow between your knees. That can help a lot as well.
Okay. Okay. Pardon my pronunciation. Somebody would like you to speak on spondylolisthesis.
Is it
Did I
maybe
get that right?
is it spondylolisthesis? Maybe spondylolisthesis or
Maybe. Okay.
So there's two common terms. So one is spondylosis, which spondy just refers to your spine essentially. So spondylosis means arthritis essentially, or inflammation of your back. That's kind of the wear and tear or the arthritis of your back. That's very, very common. Spondylolisthesis, which I think is what that question was referring to, that is what I was talking about when one vertebrae or bone of your back is moved forward compared to another one. That's also relatively common. A lot of patients have it. It does become a problem if that area of your spine is unstable and it's pinching the nerve. So if you are diagnosed with that, and certainly if you're having leg pain or arm pain as a result of it, I think that's a good reason to seek professional help.
Okay. Can exercises rotating the neck cause more pain or is it helpful? And do chiropractors improve herniated disc pain in the neck?
Yeah, that's a great question. I certainly exercises for your neck are terrific. There's a lot of great ones that therapists and chiropractors use for neck strengthening, stretching. Obviously, if you overdo anything, you can increase your pain. Um, Chiropractors and physical therapists both do a lot of neck massage, strengthening, flexibility exercises. So the key is really finding a therapist or a chiropractor that you like working with, but they can certainly improve neck pain. In terms of the discs, some people do really like gentle traction on their cervical spine, can alleviate a lot of that pain from herniated discs.
Okay. What is the role of the piriformis muscle?
Yeah, that's a good question. So the piriformis muscles is one of the muscles that essentially goes from your low back to your hip, and it helps rotate your leg at your hip. The issue with it for a lot of people is that the sciatic nerve, that nerve that runs down your leg, I showed in that one image, it runs right underneath it. So some people get a very tight piriformis muscle and it pinches that nerve. And that's a diagnosis that a physician or a therapist could make with you, and they can work on stretching your piriformis muscle to try to alleviate that pain.
Okay. That's all the questions I've had. There were some questions that we received that were really more of a personal nature. Those should certainly be addressed to your own medical practitioner. And as always with Spirit programs, everything you've received here is general information. We do not make any decisions based on any Spirit program. So you have to speak to your own medical doctors and everybody else who's involved in your medical care, and not base anything on anything you've heard in the Spirit program. I want to thank Dr. Buza so much for such an informative program. I think this was wonderful. I know there's going to be a request, Dr. Buza. Would we be able to get copies of any of the slides? You had some on exercises. Are there any of those things that you could give us to send out with the recording?
Absolutely, absolutely.
Okay, so I'll talk to you about that later. So thank you so much. Just a couple of announcements. Next week, we're going to be welcoming back Rebbitzin Fevgi Horowitz, who will be speaking on virtual Bikur Cholim, something that so many of us need to do now. As well, that's on Tuesday, and on Thursday, Jay Goldberg, who was on our relocation program when we spoke about in the summer. And he's going to be speaking next Thursday on revealing Jewish American heroes from the Revolutionary War until today. I want to remind everyone, because I've gotten a few emails of people that are looking back to some of the links I sent before November, and they're saying they don't work. You're right, they don't work. But not to worry, those are all in the archives, and every email does have a link to the archives, so you can get anything there. And when you're in the archives, you can download as much as you want. We look forward to hearing how much you're using them. And now there is a search by presenter, and we're pretty much finished with our search by topic. So that should make it pretty easy for you to navigate it. And I just want to mention, of course, that during the month of Kislev and in December, many of you are finalizing your contributions to charity during the year. So at this time, please consider giving to the OU Spirit program so that the Orthodox Union can continue this valuable programming for all of us. That's, I think, all of my comments. Have a wonderful day. Thank you for joining us. Have a great Shabbos. Be safe and healthy, and we look forward to seeing you next week. Again, thank you so much, Dr. Buza.
Thank you.